All right, well, welcome to the last lecture of the semester. And today we're going to talk about the male and female reproductive tract. Primarily, we're going to focus on that of humans, although this is quite similar in other animals as well. So if we start with a human female reproductive tract, you notice that we have our two ovaries here. The ovaries are able to go through meiosis. Cells in the ovary able to go through meiosis and produce eggs. So you see an egg coming out there. So during ovulation, eggs are produced. Actually start off, females are pretty much born with all the cells that are going to be able to form eggs, and eventually they'll turn into eggs as they travel up the fallopian tube or uterine tube. And this is typically where the egg will become fertilized somewhere along in here. After the egg is fertilized, if it is fertilized, it will implant down in here into the endometrium. So this structure right here is the uterus, and the inside portion of the uterus is the endometrium. That's the inner layer of it, and the endometrium is where the egg, or actually the zygote at that point, will implant. The zygote, if you remember back several weeks ago, is a fertilized egg, single diploid egg, two sets of chromosomes. And so anyway, that's the endometrium, that's the uterus. Down below here is the vagina, and at the top of the vagina is the cervix, and that little tiny opening then leads to the uterus. This is a close-up view of the ovary, showing you what happens here with what's called the primary oocytes. These are the cells that are going to be destined to be able to become an egg. And what happens is under the hormone, follicle stimulating hormone, I'll show you that in a second, a follicle develops, and during ovulation what happens is that follicle ruptures, that egg comes out, which will become the egg and can become fertilized by a sperm. The remaining cells of that follicle form what's called the corpus luteum, and the corpus luteum secretes hormones that keep the endometrium intact. Estradiol, estrogens, and progesterone, assuming that there's no pregnancy. And if that corpus luteum starts to shrink and disappear, it disintegrates, it stops releasing the estrogen and the progesterone, and the female then goes through ovulation. Not through ovulation, through menstruation. That's what word I was looking for there. So anyway, let's go back. So once again, so here's the whole cycle here. Here's the ovary, and here's the after ovulation, there's the egg. This is, like I said, where the fertilization often occurs. So you see the sperm swimming up there, and then this then goes through mitosis. So after it's fertilized, this process here is then mitosis. And as it goes through mitosis, what ends up happening is it divides and it becomes 2 cells and 4 cells and then 8 cells. Then it continues on, and eventually it will implant into the, assuming it was fertilized, into the endometrium, and that's where the baby will begin to develop. As I was saying, you can sort of look at ovulation and the female cycle, and actually the male cycle also, but less detail going on in the male on this in terms of the hormones. But what ends up happening is if we take a female's typical menstruation period of about a month, of about 30 days, what happens is at the first sign of menstruation, the first sign of bleeding, that typically happens for anywhere from a few to 7 days or so. And all these numbers, by the way, can vary very tremendously based on just differences in women, differences in age, number of children they've had, in various factors. So lots of things can change this. So this is sort of an ideal cycle, and I'll try to mention that several times. But what ends up happening is at the end of menstruation, the last day of menstruation, what happens is the LH and the FH levels are sort of low. And as the LH and FH levels sort of remain sort of low, what ends up happening is the LH will cause the release of estrogen, the increase in estrogen, and a little bit slower than that, the FSH will cause this slow, the follicle developing. So the FSH is causing the follicle to develop. As the follicle gets bigger, the estrogen levels and the progesterone levels start to rise. And then what happens is those serve as what we call a positive feedback loop. This increase in estrogen as it rises at first actually increases the LH and FH level. And what happens is as the LH level spikes, what ends up happening is that ovule, or that follicle, that developing follicle, will rupture and ovulation will occur, and that's when the egg will come out. And you'll notice there's a spike for both the LH and the FSH. And at that point, what happens is the estrogen level starts to drop off, and the remaining cells of that cycle of the ovulation will form the corpus luteum. And that's what they call here the corpus luteum, is the yellow body, and that yellowish color is the structure of the corpus luteum that starts to release then progesterones and estrogen. So you notice those levels remain pretty high, and all the while the estrogen is being increased and the progesterone, you'll see that there's this proliferative stage or phase of the endometrium. So the endometrium is developing, and you get this thickening of the endometrium with a blood supply. And at that point, between around day 14 to day 28, the endometrium is totally intact. And so this is where the endometrium, sort of that whole layer there, that's all thick tissue, blood-filled tissue, ready for implantation of the embryo, should that occur. And so ovulation typically occurs right around day 14, and so there's a window between right about, maybe here and right about there, in which you're most likely to become pregnant. So ovulation occurs right around day 14 on the sort of idealized cycle. Sperm can live inside the female reproductive tract from somewhere between 2 and maybe 4 to 5 days. Sex anywhere in between there, unprotected sex without any contraceptive or any type of birth control, if ovulation is to occur in that window between maybe day 12 and 16 or 17, is statistically sort of the most likely scenario of when a woman could get pregnant. However, there's a lot of variation in that. Ovulation can occur way before that or way after that. Sperm can live longer than 2 to 4 days sometimes. And so really this day 14 is sort of the idealized statistical map of when pregnancy is most likely to occur, but that can vary for a lot of a lot of factors. And what happens is, if that corpus luteum disintegrates and fertilization does not occur, what ends up happening is again varying, but around day 28 to 29, 30 or so, this endometrium will start to disintegrate, and you'll be back here because menstruation will occur, and you'll start the cycle all over again. If we look at the male a little bit now in detail here, the male, of course, you have the penis here, and the penis is used to deliver the sperm. The sperm develop in a male, at least in a human, as well as most other mammals, with the exception being whales and some other marine mammals. What happens is the testes sit in the scrotum, which is kept sort of away from the body, which allows them to be about 2 degrees cooler. And that seems to be the ideal sort of scenario. Body temperature tends to be a little too warm. So they develop in the testes, and then they mature in this structure called the epididymis here. So that's sort of, is a comma-shaped structure of network of tubes that sit on top of the outside of the testes, and inside the testes are the seminiferal tubules, and that's where the sperm are produced. And they mature in the epididymis here. During ejaculation, they travel up the vas deferens or the ductus deferens. They travel up. They go up through into the body cavity. They travel up, and then they come out this way through the urethra. And along the way, they come across several vesicles, several accessory glands that produce things like the seminal vesicle, for example, which it produces 60 to 70% of the volume of what's in an ejaculation. Fructose being one of the big things there. So the fructose is a sugar, and that's used primarily as the energy source. Prostate gland secretes some alkaline solution, so does the seminal vesicle. Also produces some lubricants there from the bulbourethral gland, located down here. That can also, the bulbourethral gland secretes a sort of clear solution that actually will deliver sperm out even before ejaculation. So sperm can be, if you be even before a male ejaculates, it can be sperm traveling out the urethra. So the popular theory of the pull-out method turns out to not be so good because the bulbourethral gland can actually deliver sperm through there. So what happens is the sperm travel through this area. They come through the prostate gland, like I said there, the seminal vesicle, as well as the bulbourethral gland, and all those fluids along with the sperm get delivered. And what happens is the vagina tends to be pretty acidic. And so in order to prevent the sperm from dying, a lot of the alkaline solutions from the seminal vesicles and the prostate gland are designed to sort of neutralize that, to give the sperm a chance. Typical ejaculation has something like 200 million sperm in it, and most of those are going to die within the first few hours because of the hostile environment, the acidity and so forth of the vagina ends up killing out most of those right away. But it only takes one successful sperm to travel up into the oviduct, fertilize the egg. Here's another view of it, just showing you sort of the same thing. Should also point out one thing, for example, here's the prostate gland, which in men primarily starting at around age 40, but around age 65, many men, something like most men after age 65, tend to have some prostate problems where this swells up. And an easy way they can test that is a doctor can do a rectal exam. They stick their finger in and they can feel the sort of size of the prostate gland, and you can get a feeling of how firm or hard that is and if that's going to become a problem. But you notice that the prostate gland, because of its location and how the bladder, the urinary bladder, which is where the urine comes from, if that sort of swells or creates pressure, that can close off this portion of the bladder and make it difficult for urination to occur. Same picture, once again, that I showed you before, showing you this is where fertilization typically occurs, in the uterine tube or the fallopian tube. And this shows you a couple different types of methods of contraception. You've probably heard of these before, of course. The condom, very popular one. Diaphragm, not as popular or not as common now. Uterine device. So this is a device inserted into the uterus. All three of these are sort of non-surgical. And then there's some more permanent methods. For example, in a female, you can do what's called a tubal ligation, in which they do surgery and they essentially tie off the fallopian tubes. They cut them and surgically sew them closed. And in a male, you can do the same thing, called a vasectomy, but it's much easier in a male. Although new surgical techniques allow us to do arthroscopic type of surgery, where you can kind of go in with a small puncture wound in a female to perform this kind of operation. In a male, it's actually very simple. It's an outpatient surgery where they can kind of do this just, in just a few hours. But essentially you numb the area and they just make a little snip in the scrotum, and they can reach in, pull out the vas deferens and tie that off and surgically enclose that very, very quickly, and quite simple. Much more simplistic of a surgery to do a vasectomy than a tubal ligation. And the last thing I'll conclude with, just to show you here, if this is the endometrium wall, a blastocyst is a growing baby that's basically, at that stage about the 7th day. So it hasn't even implanted about that time. And then it will implant in the endometrium, and this will be the start the formation of the growing baby as it implants even further. And you can see at this point it doesn't look like anything but a group of cells. So it's implanted into the endometrium, and it's starting to expand and grow, and eventually it'll grow this placenta, which will be a sort of interaction between the baby's fetal artery and veins as well as the maternal side, with the maternal arteries and veins delivering blood from the mother to the baby, and that's how the baby gets the nutrients as it develops, starting off at about 3 weeks. So before the baby is born, this is what it looks like at, say, 3 weeks into fertilization, and then 4 weeks and 5 weeks, 6 weeks, 7 weeks, 8 weeks. And you can see very early on some of the first things that happen. First, you'll notice heartbeat around 2 months or so, actually around 4 weeks. You can notice a heartbeat at that point. And at this point, most vertebrates, whether it's a chicken or it's a frog, at this point even, chicken, frog, lizard, pretty much all the vertebrate animals kind of look the same. They have the very same kind of look to them. And as we progress, you notice fingernails and ears. The tail disappears. Notice there's a tail early on, so this is a human. Some animals would keep that tail, but in the case of a human, that begins to disappear. And the brain's one of the first things that begins to develop very early on. So the brain's enlarging here at week 5, and you can see by week 8, so 2 months in, arms and elbows and genitals begin to form. And if we continue on, one of the last things that develop is the lungs. So a lot of babies that are born prematurely, one of the things that is the most problematic is the lung circulation, because that's one of the last things to develop. And somewhere between 7 months and 9 months, usually around 9 months or so, the baby's born and is fully developed. Even as early as around 7 months or so, though, you can have a viable baby born, often with complications, mainly, like I said, of the lungs. And once again, there's the parting shot of the baby growing, and that will be it for now. That's another picture you can see in this one here. Not only can you see the head, you notice that babies have these very large heads in the beginning. You can even see ribs in this case. You can see the knee, and you can see the femur bone there, as well as the toes and the feet and the hip right there. So this baby's coming along very, very well at that point. Even further along here, the skin starts to gain more pigment, so it's no longer clear. And this is kind of what it looks like at around 8 or 9 months or so, with that baby pretty much fully developed and waiting to come out. Notice kind of cramped in there quite tightly. So babies are kind of used to this during pregnancy, and so this is one of the reasons that you can swaddle them up. If you've ever had a baby, you can wrap them all up in a blanket and keep them warm. And you might, as an adult, I always thought that seemed claustrophobic, but to a baby, it's probably very much like what they're used to.